Hello, Dr. Adi Aran. It's a
Hi.
great pleasure to have you here today. Thank you for taking your time for schedule to talk with us,
Sure.
with the directors from APAE and the parents of children with disabilities. So therefore, thank you very much.
Thank you. Thank you for having
Um,
me.
Thank you. Just saying a few words about APAE. APAE is a Brazilian nonprofit organization dedicated to supporting people with intellectual and multiple disabilities, promoting their social inclusion, education, health, and overall well-being. APAE operates in various cities across Brazil, not only the capitals, but also in small towns where support is needed and much needed. The organization offers services such as an early intervention, education, therapy, and advocacy for rights of individuals with disabilities. So we are here today to talk with one of the biggest names in cannabis in the world, Dr. Adi Aran, and therefore, for me, is the biggest researcher and scientist that is currently researching cannabis today, Dr. Adi. Welcome, Dr. Adi Aran.
Thank you. Thank you for having me.
Okay, uh, let's dive into the questions. The first question I have for you is I would like you to introduce yourself a little bit and to talk about your background and what motivated you to study medical cannabis for children.
Okay, thank you. So my name is Adi Aran. I'm a pediatric neurologist from Jerusalem, Israel. So as a neurologist, I am treating children with various neurodevelopmental difficulties, for example, epilepsy and also autism. And as you may know, cannabis has been suggested for epilepsy in the last 2 decades. It was suggested for epilepsy even before, but in the last 2 decades, more studies emerged and it became more prevalent. And I've started treating children with autism and epilepsy with cannabis, and some parents reported that it also helped in the behavioral problems, in the social deficits. Sometimes it's only helped in the social deficits and behavioral problems, and not in the epilepsy. So we thought we may assess this in a formal study or formal studies, like to see if the cannabis really helping children with autism. There was some biological logic for that. We know that in autism, there is involvement of the endocannabinoid system. The endocannabinoid system is a system in our body, and especially in our brain, that want to make things more even, like neuromodulation and other important brain function. So it's an important neuromodulatory system. And we know it from animal models of autism and also from studies in humans that the endocannabinoid system is involved. And in some of these models, when we treat usually it's mice model, when we treat the mice with CBD, cannabidiol, it can reverse the symptoms. So there was a logic to it, and we tried it. And I must say that cannabis is not like a magic bullet for autism or for the behavioral issues. It's not like a magic treatment for everything. I think that there is quite a lot of hype around cannabis, but there is something to it. So studies are emerging, and personally, I have a lot of experience with hundreds of children with autism, and it's definitely more than a placebo effect. It's not just a placebo, but we
And
should further explore that, yes.
do you consider cannabis treatment to be safe for children?
So I think that nowadays there is enough data that we can say that if we use the right strains of cannabis, like the right ratio between cannabidiol and tetrahydrocannabinol, between CBD and THC, in the right doses, of up to 10 milligrams per kilogram per day of CBD, it's quite safe. So there are still questions about the efficacy of this treatment in autism, but I think that there is an agreement that this line of treatment is relatively safe and also tolerable, which means that the adverse events are not substantial. So there are mild adverse events, as we have in any pharmacological treatment, but less than antipsychotics or other medications. The safety issue is quite resolved now, 10 years after we started treating that in thousands of children, but the efficacy issue is still a big question.
Mm-hmm. And let's dive into the second question. For those who want to research and develop work in this field, especially such a specific and sensitive topic, such as children, right? We have most appreciation for children, and it's we know that every treatment we make could develop lots of echoes, right, in the later life. So, can you share what's your biggest challenges in your past researches, and what do you think would be the future challenges for cannabis research in children?
So, as you say, we are more cautious when it's we are dealing with children, and everything can influence their development. So we were very cautious at the beginning with the doses, etc., and the age that we can start, because in autism, as you probably know, we like to start as early as possible because earlier treatments are more effective. We know that from the behavioral treatments, and we hesitated to start earlier because we didn't know what the cannabis will do in very early days. So we gradually decreased the age. So currently the formal age in Israel is 4 years, and we are trying to even sometimes try even earlier. So the age is one issue. And also the issue of the components, because CBD is relatively safe treatment. In some countries, CBD is not considered a drug or something that is illegal. In many countries, the THC is, because it's psychoactive and has many risks, but the CBD is considered safe. But we are afraid that CBD alone will not be enough for children with autism. For epilepsy, there is evidence that CBD might be effective even when giving alone, like we do with Epidiolex for certain types of epilepsies. But in autism, we are afraid that CBD alone won't be enough. And actually, there is one study that we have results already. It was not published yet, but if you look in clinicaltrials.gov, you can see that this study in North America, a multi-center study that assessed the Epidiolex in autism and was not successful. So CBD was not enough for the core symptoms of autism, and also not for the major behavioral assessments that they used. They targeted the core symptoms more than the behavioral assessment. But even though we're afraid that CBD alone won't be enough, and we would like to give also THC, not a lot of THC, like minor amounts of THC, and with much more CBD than THC, like 20 times more CBD or even 28 times more CBD than THC. But we think that some THC is required. We know that also from animal studies, but we are cautious because THC might be risky in children with autism.
I saw one study recently that shows that people with ADHD and autism have a lower levels of anandamide, right?
So there are studies in humans in autism in general, and also in autism with other comorbidities, that the endocannabinoids are low. There is one study that we did with 93 children with autism compared to 93 children with typical development, but also other studies from California, from China, and CBD and endocannabinoids like anandamide are indeed lower in the serum of children with autism.
So therefore, it makes sense that supplementing a little bit of THC to compensating this anandamide suppressing, right?
Yes, so THC, like anandamide, directly activates the endocannabinoid system in the brain, directly activates the cannabinoid receptors, CB1, the primary endocannabinoid receptor in the brain, so it makes sense. But also we have to be cautious with THC because THC can cause psychosis, and children with autism are prone to neuropsychiatric complications, so we have to be cautious with THC, but I believe that some THC is indeed required.
Okay, and in this 20-to-1 or 28-to-1 proportion, the THC is considered to be a little bit safer because of the amount of CBD that is somehow suppressing the THC to exploding.
So it's considered to be safe. Actually, we don't know if indeed CBD can compensate for the THC complications, but we believe that it is. So there are some evidence that CBD can mitigate the risks of THC.
Okay, thank you. And the third question, then, how did the parents of the children react at the beginning of the clinical studies? And did you face any specific difficulties with the parents?
Actually, the parents were the ones to push for trying this treatment. So the parents that we recruited were those who wanted to try the treatment. Parents of children with autism are in a constant look for the new treatment because they are quite desperate. There are no pharmacological treatments that are effective for autism, for the core symptoms of autism. And they usually want to try more than the physicians would like to do. So the physicians are more conservative usually, and the parents want to try new things. And so at first, the parents were those who pushed me to try this treatment.
That's good, because here in Brazil, we are facing a lot of prejudice because we heard about the bad side of cannabis for almost 150 years. And somehow some of the parents are still sketchy or with lots of doubt.
Also in Israel, many parents are hesitating, but I explain that this is called cannabis, but it's not like other cannabis, like it's not like recreational cannabis because the THC is very low and the name is the same, but the effect on the brain is completely different.
I used to explain for the parents such as the dog, the breeds of dog that we selective breed and separate, and the phenotypes are way different. We have the same with cannabis, and we have a lots of different characters, even in a plant, so they can understand better sometimes.
Yeah, it's a good example. Yeah, I will use it.
Thanks. And the fourth question is, have you ever had to face any governmental or institutional resistance for your colleagues or anybody?
Yes, for sure. So at the beginning, there was more, even regulation-wise, the regulation was not so easy, and we had to try as a compassionate care with those children with autism who were the most severe children. Like, we've tried everything and nothing helped, and they really suffered, and their families as well, and it was a compassionate treatment. And with time, as regulation became more easy, and also with other physicians, mostly psychiatrists. At the beginning, the psychiatrists were really against this line of treatment. And with time, they saw that in many cases, not in all cases, of course, but in many cases, when other medications failed, this might be another option to consider.
Yeah, that's good. Thank you. And other question is, what has changed in your perspective from the early studies until now?
So I think with time, I and other people in this field, we learned that this line of treatment is relatively safe indeed. Like, we didn't see any significant or substantial adverse events or risks, but it's also not as effective as we thought at the beginning. So in some cases, children are being treated for many years, and every time they try to stop it, they regress. But in other cases, we don't see that improvement that we hoped for at the beginning. So it is an option, and in some cases it works, but in some cases it doesn't work. So it's not like, as I said, it's not a magic. It's another tool in our toolbox, but we have to.
It's just another medication that can works and cannot and can even not work with a specific group of people, right?
Yeah, sure. In some specific groups, it has some advantages. For example, in overweight children, it might has advantages over the antipsychotics or other medications that can cause obesity, and this line of treatment is reducing appetite. So in some cases, it has advantages.
Mm-hmm. And is there a specific profile of autistic patients who respond better to cannabis?
So we've tried to look for answers to this question, and I cannot say that currently we have these answers. We are still trying. I think that for the behavioral problems, it works better than for the social deficits or repetitive behaviors, and mostly for the self-violence or severe irritability, it works better. I cannot say if it's work better for younger children or for older children or for higher functioning children or for lower functioning children. I think the variability is still too high, or for some genetic problems specifically. Sometimes we think that for children with SHANK3 mutations or for other specific causes it works better, but we don't have this data yet.
Mm-hmm. And what is still needed for medical cannabis to be accepted as a first line of treatment for autism?
So I think there is still a way to do for it to be first line. I think that, as I said, if we are looking at safety and tolerability, it can be first line, but if we are looking at efficacy, there are still medications that are probably more effective. I think that the antipsychotics, when they work better. The effect size is higher than the cannabis. So I think that still we will have more data about specific subpopulations and or specific biomarkers that can predict the efficacy. It won't be first line in the next years, but maybe with further studies and, as I said, finding specific biomarkers that will predict the efficacy in this population, it might be a first line for some subpopulations of autism.
Mm-hmm. Nice. Thank you so much. We come to the end, and I wanted to ask you another question, if you can answer, is what do you think about the interactions between antipsychotics and cannabis? Do they work well together, or they are like not working well together?
So many of my patients are receiving both antipsychotics and cannabis. First, in Israel, it's not always being forced, but according to the law, you cannot start cannabis if you didn't try before antipsychotics. So many children tried antipsychotics. Some of them stopped it because they had adverse events or it completely didn't help, but some of them continue. It's helped, but not enough. And so many of my patients are receiving both. And for most cases, it works okay as a combination. We know that for some combinations, we have to be more cautious, but not with antipsychotics. It is true for example, benzodiazepines. We know that sometimes we have to decrease the dose of the benzodiazepines a little bit if we are using cannabis, because it increases the influence. Also, if we use it with depalept or valproic acid, we have to look for the liver enzymes that sometimes became a little bit high. But with antipsychotics, usually we don't have some special issues.
Mhm. So thank you so much, Dr. Adi
Okay.
Aran,
It was very
for
nice.
giving me this interview. It was very, very nice. And I hope this can bring a little bit of light into this very misty uh, environment of cannabis, right? Because some of the parents here are still afraid or something. And for me, it was especially very enlightful, because, as you said, is another tool in the box. We
Mhm.
have to consider this as just another medication. I also believe that
Mhm.
there is a lot of hype in cannabis, and it's so good to put the feet on the ground
Mhm.
and talk about what we know actually.
Thank you. Thank you so much. It was very nice.